And thank you for joining today's webinar. We'll probably have a few people joining us over the next few minutes, but in the interest of time, we'll get started. So today, obviously you're all here for the launch of the new report on human learning systems, public service for the real world. And I would like to thank you for joining us. We know that Zoom fatigue is real, as is the weariness that comes from going in and out of lockdown and dealing with homeschooling and all the rest. And the whole of the Sydney Policy Lab and Centre for Public Impact teams are so excited that you made the choice to be here this evening. And for those of you in the UK time zone this morning, and to be here together with us and with each other. My name is Louise Behag, and I'm from the Sydney Policy Lab at the University of Sydney. I'd like to begin by acknowledging the Gadigal people of the Eora Nation, which is the land that I'm speaking to you from today and where I live and work here in Sydney. I also acknowledge the traditional custodians of the lands on which each of you are living and learning and working, and pay our collective respects to elders, past, present and emerging. And I also recognise that sovereignty has never been ceded, and this always was and always will be Aboriginal land. So we have people joining us today from across Australia and a few other places as well, from all sorts of different backgrounds. And we would like this to be really interactive. So thank you to those of you who have introduced yourself into the Zoom chat. I'd like to invite others too as well, just to say where you're from and also share the lands that you're calling in from. While you're doing that, I'll kick off with a really quick overview of what we're going to be doing for the next hour and a half. First with who we are, second with what we'll do, how this will run, and then third, a quick note on tech norms. So I do see a few familiar faces, but also some new faces. So please indulge me for 30 seconds while I give a really quick overview of the Sydney Policy Lab and why we're so excited to be co-hosting this event with the Centre for Public Impact. So we're part of the University of Sydney, and we exist to bring together researchers with people outside of the university, including policymakers and civil society organisations, advocates, campaigners, journalists, politicians, artists, and others. And we do that in order to unlock and catalyse new knowledge and ways of doing things that wouldn't have otherwise happened if people were working in their traditional silos. So we try to combine the minds and the hearts of academia with the minds and the hearts of practitioners to work on complex challenges that affect how we and the people around us live, work, raise our children, connect with each other, look after our physical and mental health and the economy and the environment, and generally just try to live a good life. We have a particular emphasis on the wisdom that comes from lived experience and understanding and designing solutions with people, not for people, from the very beginning. And our work focuses on the power of relationships, and specifically on building relationships between people from all walks of life so that people can work together across boundaries and across difference on shared issues. So we were really excited when Toby Lowe and Thea Snow suggested that we co-host together with the Centre for Public Impact the launch of Toby's new report on human learning systems, because there's a lot contained in the report and the case studies that resonate with us, particularly around the weaknesses of the current models of public management and the need for something different, and something that recognises the importance of building relationships and the conditions for trust and safe spaces for learning. So Toby and his team have pulled together an incredible bunch of insights from nearly 50 case studies across the world. And we're so pleased that Toby has got up early in London, hopefully with a strong coffee in hand, to share some of those insights with us today. That doesn't look like it's strong enough to be coffee, Toby. Today's session will be in 3 parts. First, we'll hear from Toby. Then we'll hear from 2 incredible people here in Australia who will share what this looks and feels like for them. So we have the brilliant Nat Smith from the New South Wales Aboriginal Housing Office, who will talk about Aboriginal community-led development. And we have the equally brilliant Jane Mccracken from Hands Up Mallee in Victoria. And then the third part of today will be a panel discussion hosted by Thea Snow. We don't want this to be like a standard lecture. We want it to be about stories and ideas and interactivity. So please use the chat bar to share your ideas and comments and questions, and you will have the opportunity to put questions to the panel as well. Feel free to participate as much or as little as you like. Quick note on tech. If you drop out, we have people on standby to let you back in. Please keep yourselves on mute. The plenary talk will be recorded, and I'd like to invite people to tweet by using the hashtag Human Learning Systems. That is it from me, but before I hand over to Toby, those of you who know the Sydney Policy Lab know that we like to get to know each other. So we're going to do a really quick speed date hello. Obviously, there are too many of us to do a round in plenary. So what we're going to do is send you off into groups of 2 where you'll have the opportunity to randomly meet up with somebody else. And all you have to do is introduce yourself, say who you are and what motivated you to sign up and come along today. So this will be the only compulsory interactive bit. So please don't be worried, it will be short. We'll give you 4 minutes to do that. So we'll send you off and then bring you back and hand straight back over to Toby. With a little bit of time for the tech to work.
Sorry, Louise, just give us a few minutes. I just
no worries.
Thanks.
If it seems like it might be a little bit tricky, we can just do that in the chat and we can move on to Toby, but let me know what works.
Yeah, I think, Louise, if people can just do that in chat and use the chat function.
Cool, we'll do that. Thanks, Janani. I will hand over now to Toby. While Toby is talking, feel free to keep on popping your comments in chat.
Thank you very much, Louise. So let's see if I can share my screen. Just like that. Can someone give me a thumbs up if you can see a big green knot? Excellent. So thank you so much for inviting me to speak with you today. My name is Toby Lowe. I'm visiting professor of public management at the Centre for Public Impact, and I'm on loan to CPI from Newcastle Business School at Northumbria University. But prior to getting involved with any of this on a kind of academic basis, I worked for 15 years in the public and voluntary sector in the UK. So I'm exactly on that kind of practitioner academic kind of connecting point that Louise was talking about. So I'm going to talk to you today about the new ebook that we published last month, Human Learning Systems, Public Service for the Real World. And essentially what I'm going to say to you today is that you've got a choice about how you do public management, and that if it feels wrong right now, if how you do public management feels wrong to you, then you can change it. So those are essentially my 2 key messages. You've got a choice, and if it feels wrong right now, you can do it differently. So let's get into it. Let's start with the definition. So we're talking about here how public service is organised, and so it's maybe helpful to start with a definition of public service. So we understand public service as all purposeful work that supports human freedom and flourishing. So you'll see from that we don't think that public service is about sectors, so it's not about public sector or voluntary sector or private sector. All purposeful work that supports human freedom and flourishing we put under the heading of public service in this report. And we would start with a question for all those who are doing public service then. Do you have a feeling that there's something wrong with the way that public service currently supports human freedom and flourishing? Because we think that if it feels wrong, that's because it is. And where we would want to start with this is, if you're feeling like there's something fundamentally wrong, it's not because you're a bad worker or a bad manager or a bad leader. It feels wrong because we have a public management problem. What do I mean by that? So public management is simply an umbrella term for the discipline of how public service is planned and organised. So, and there is a currently dominant paradigm for how public management is done. It's got a name. It's called New Public Management. It was created in the 1980s as a deliberate kind of ideological choice about how public service is planned and organised. And it's often known as the 3 M's: markets, managers, and metrics. Now, I won't go into the detail of that there, but you can see from this slide some of the key factors of it. And undoubtedly, I think that you will recognise aspects of how these plan and organise public service in your different contexts. The only problem is that new public management doesn't work. Just doesn't work effectively in complex environments, and we know that because of the evidence around new public management. So the new public management reforms began in the 1980s. So we've got 3 or 4 decades worth of evidence now about what happens when people implement a new public management approach. And so this is from Christopher Hood, who's one of the preeminent public management scholars in the world. He says, what do we have to show for 3 decades or so of NPM reforms? Short answer: higher costs and more complaints. And you can see this also in the evidence of what happens when you dig into some of the key practices of new public management. So, for example, target-based performance management, systematic review of target-based performance management. Over 80% of the studies find evidence of gaming, and nearly 3/4 find evidence of people deliberately lying. So what the evidence around new public management helps us to nail down is the myths around new public management. So these 2 pieces, just a fraction of the evidence, show really clearly new public management does not create accountability. It creates a culture of kind of pretty much universal deceit. So it does not create accountability, and it does not create value for money. So these are some of the things that by using the evidence around this, we can help to nail some of the myths around new public management. But what it does create is a simplified fantasy world in which the abstractions of data points substitute for the complex reality of life. So we've seen from the evidence that people are operating with performance data that's routinely gamed. People are writing plans that they know won't happen. People are creating budgets that they know don't reflect the reality of the work. And worst of all, what we found from working alongside people is it treats the people we serve as data points, not as full human beings. So if that's some of the problems with new public management from the evidence, I also wanted just to kind of tell a couple of human stories to bring this stuff to life. So these are stories that we heard as part of the research work we're doing around this. So the first story I want to tell you is a story from Gateshead Council in the northeast of England, where I live and work. They've been trying a kind of human learning systems approach to working with people who are in council tax debt. So what they were doing was trying to reach out to people who were in council tax debt and say to them, let's just put the debt aside for a minute. We want to form a relationship with you, find out what's going on in your life, find out what your strengths and needs are, and whatever your strengths and needs are, we'll try and help with those. So one of the people they reached out to immediately, on kind of hearing this from the council, put the phone down, phoned the council switchboard and said, I've just had a prank call, someone pretending to be from the council. I knew it couldn't be the council really, because they offered to help. Now let's pause just for 1 second. Members of the public have got so used to the idea that public service will not help them with the unique context of their lives that anyone offering to help cannot be from the council. Right? Let's just take a moment to see what it is that we have done to public service to generate that thought in people's minds. Second story. This is one that I was personally witness to. So I was witness to a conversation between a senior commissioning manager for National Health Service and a director of finance for an NHS delivery organisation. And the commissioning manager was saying, oh, I've got a team of people and we're trying to change the kind of costing basis for NHS activity to reflect to get the cost to reflect outcomes better. And we're finding that really difficult. It's really challenging to get a cost structure that enables outcomes to kind of feature in NHS activity. And the director of finance said to him, don't worry about it. Like, I've got a team of people who just kind of whatever cost information you ask for. I've got a team of people who just make up the figures for you. You know that's what we do, right? We just make this cost information up. And the commissioner manager was like, yeah, I know that's the game, right? Again, let's just pause and let the ramifications of that sink in, right? You've got two teams of really quite well-paid people whose entire job is to make up figures for one another. Gives us a little example of why new public management creates higher costs and more complaints, these two stories, right? This is the reality of what new public management means in practice. So, most important message from all of the stuff that we've done is that you have a choice. So if you're experiencing these kind of failures of new public management, you can choose to do public management differently. And from our experience, that choice starts by embracing the complexity of the real world. Because for too long, as public managers, we've been trapped in a little box that pretends that the world is simple and linear, that if we do A, then it leads straight to B. As this beautiful little cartoon illustrates, if we open the door to the complex reality of the world and how it is, then that forms the basis for doing public management differently. Let's stop pretending, eh? So this was the kind of starting point for our new report, Public Service for the Real World. So what we did was we've been working with kind of over 48 different case studies of organizations doing an alternative way of doing public management that we call human learning systems in practice. And 29 of those case studies were created specifically for this report. And they're from like small scale local voluntary organizations through to national government. So I am confident in talking about what an alternative approach to public management looks like, because we've seen these people do it. Right? So this is based, what I'm presenting to you today is the learning from the doing of a whole range of people and organizations. And the other thing to say about this is it's me fronting this today, but there's over 35 organizations been involved in producing this report. You just get my face talking to you today. Other caveat I would say is that despite all this kind of case study basis for talking to you, that our knowledge around this is incomplete. Because every time an organization implements these kind of principles, we find out a different set of practices. Because what I'm talking to you today isn't a model, it's a set of principles. And every time that they're put into a different context, the practices look different. And so one of the things I'm really curious about today is how does this stuff resonate in an Australian context? Because we don't have written case studies, we've not done the kind of research in this context. So mostly the work we've seen comes from Europe. There's a little bit from the States as well. We've had some conversations from people in Australia, but we don't have any kind of fully fledged written case study. So one of the things I'm really interested in hearing is how does this resonate in an Australian context? And if it's completely not right, then that's really interesting and useful to hear as well. So let me dig into this. Human learning systems. So this kind of talk speaks to the fundamental beliefs of human learning systems. As I was saying before, we believe that the purpose of public service is to promote human freedom and flourishing. So everything starts from there. But also it contains a fundamental belief about what it is for public service to see a human being. And so what we found is that to understand a human being is to see them in the complex web of relationships that is their lives. So this is a view of human beings that talks about radical interdependence between human beings. And these beliefs have consequences. So if we believe in the purpose of public service to promote human freedom and flourishing, and we believe in radical interdependence of human beings, then it creates two consequences. Firstly, that only we have the right to determine outcomes in our lives. So if you take human freedom seriously, then the only person with the right to determine what a good outcome looks like in my life is me. Obviously, there are caveats around that, around kind of capacity and issues around children, whatever, but the general principle holds. Only I have the right to determine what a good outcome in my life looks like. Secondly, it means that outcomes are created by this complex web of relationships that is my life. So all the actors and factors, all the organizations, all the people, all the forces acting on me all of those things combine to create an outcome. And this is really, really important because it speaks of the reality of how outcomes are made. So if we want public service to create outcomes, and human flourishing is just another way of saying we want good outcomes, right? Then we need to understand the reality of how an outcome is created. And so let's dig into this idea that an outcome is the product of the interaction of all of the actors and factors in someone's life. And we can illustrate this by looking at the outcome of well-being in a person's life. So we would say that the outcome of well-being is a pattern of results in a person's life as a system where it starts with all the actors involved in that person's life. So the person themselves, their family and friends, the people responsible for green spaces near them, their neighbourhood centres, the welfare and benefit agencies, the health services, blah, 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 all the person's actors in their life. And we can represent this as a solar system with the person at the centre of it. And then all the factors in that person's life, their income and wealth, their employment status, their health, blah, 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 blah. These are all things that are impacting on all the different actors and producing the pattern of results that is well-being or not in their life. So this is a kind of visual metaphor to help us understand the reality of how outcomes are made. And so that kind of brief overview gives us a sense of what it is to do human public service in the context that we're talking about. So the human bit provides the moral purpose of public service. We're here to promote human freedom and flourishing. And if we're not, that's a different purpose. And to do that, to promote human freedom and flourishing, a human public service has to start from the reality of the life of each person, right? And that means that human public service has to be based on strong relationships, and it has to be bespoke by design. Because if we're going to create outcomes, if public service is going to help people create outcomes in their lives, then we need to understand how each person's life is different, the unique set of circumstances and characteristics, the actors and factors in their particular life that creates the outcome of well-being or not, for example. That is the reality that public service has to start with. And the only way that it can know the reality for each and every person is by having a strong relationship with them. And through that strong relationship, supporting whatever it is that they need in their life with a bespoke response. So this is what we mean by human public service. So human learning. So now we get on to the bit of the how. How does that happen in public management terms? How do we plan and organize public service to enable that stuff to happen? What we've found is that learning is the management strategy for public service, right? So what do I mean by that? Well, again, let's root this in the reality of how outcomes are created. So creating an outcome is complex. We know this, we know it is complex because each person's life is different. And what counts as an outcome for them in their life is different. The way an outcome is made in their life is different. And all of this changes over time. So for those of you who are familiar with Dave Snowden's Cynefin framework, you'll see that this puts us firmly in the territory of the complex, right? Which requires emergent practice and requires a learning strategy for organizations to respond effectively to. So what we've found is that organizations who are able to respond effectively to each and every person's need operate this kind of learning cycle. And so I'll illustrate this with an example of how a public servant, a kind of public-facing worker might respond to someone who is experiencing chronic pain. So some of you may know this, chronic pain is pain that doesn't have a corresponding obvious physical injury. So there's no medical thing to fix behind chronic pain. This learning cycle is a process of understanding a system, co-design, experimentation, and then embedding and influencing. So it starts with the idea that the worker's job is to understand the system that is the person's life experiencing chronic pain. And not just that they should understand it, they should help that person to understand their life as a system that currently creates the outcome of chronic pain. So it is a learning relationship between a worker and the person that they're supporting. So They might ask questions like, do you experience the pain more in the evening or in the mornings? Do you experience it more at work or at home? Do you experience it more when you eat this kind of stuff or that? Do you experience it when you do these kind of actions or these kind of actions? And together they build up a picture of that person's life that currently produces the outcome of chronic pain. And having built up that shared understanding, together, the worker and the person they're supporting can then co-design a series of experiments to see if they can get that life as complex system to produce a different pattern of results, a different outcome. So they might say, what happens if you try this diet rather than that diet? What happens if you join this walking group? What happens if we do these kind of series of physiotherapy manipulations on you? Does that change? What happens if we get new equipment fitted to your house? Let's try a bunch of things and see what happens. And the results of each of those experiments and explorations, they learn from, and that results in behavior change for that person and structural change for the conditions around them. And because that results in behavior change and structural change, that person's life as system has changed. And so the cycle begins again. So we need to understand the system again. Blah, blah, blah. So what we've found is that the work becomes a continuous learning relationship between a public service worker and the person they're supporting. And running this learning cycle is the way that a human learning systems approach creates bespoke public service for each and every person. So when public servants, when public facing workers are doing this kind of learning cycle, what it means is that they are creating a bespoke public service response for each and every person. And that means they are operating with the reality of how outcomes are made in each and every person's life. So human learning systems. Quick systems 101. So, because it's important to say what we mean by the word system when we're talking about this. So system is just a way of describing a set of relationships in the world that combine to make something happen. So when we use the word systems in human learning systems, what we're talking about is the set of relationships which create a desired outcome or its absence. So that's what we mean when we say the word system. And what we've seen is that it's possible to look at systems at different scales. So we see, as I've explained before, in the chronic pain example, we can look at a person's life as a system. We've also seen people thinking about organizations as systems, about places as systems, and about countries or regions as systems. And what we've found is that at each of these system scales, people are operating this kind of learning cycle. Right? So it doesn't matter whether it's a public-facing worker working directly with a member of the public, they operate a learning cycle like this, or it doesn't, if it's a person at a local authority or state government level, they are operating this kind of learning cycle too. The crucial thing is that each of these learning cycles at different scales operate as pairs that support one another. So let's look at the pairing between a person's life as system at the smaller scale and the organization as system at the larger scale. So there's a pair, what we find is those are as a pair of connected learning cycles, where the job of the larger scale learning cycle, the organization as system, is two things. It needs to learn from all of the learning cycles happening at the scale below. So learn from all the people's lives as systems that are experiencing chronic pain. And it needs to enable all of those learning cycles to happen. So there's two jobs for the higher scale in these pairs: to learn from the learning cycles at the scale below and to enable the learning cycles at the scale below. So those two things provide the content of the learning cycle at the higher scale. So in terms of the learning from questions that they will be asking at the higher scale, the organizational system, they will be asking questions like, what patterns do we see from across all the person's life systems that are experiencing chronic pain? So, and then from those patterns, what policies do we need to enable change for people? So for example, if we're a housing association, do we need to change our housing allocation or equipment allocation policies to enable better outcomes for people with chronic pain? And secondly, there's a set of enabling questions. So how do we as an organization enable those learning cycles at the lowest scale to operate more effectively? So What are the maximum caseloads for workers that enable them to run those learning cycles? What information systems do we need as an organisation to share information across all of those learning cycles? What shared reflective practice spaces do we need to create? What are the staff capabilities that we need in order to enable to have a workforce that is capable of doing things? Those are the kinds of things that are the kinds of experiments and co-designs that people are operating at the level of organisation and system. And the overall, what we found is that the overall human learning system strategy is therefore to create connected learning cycles from the bottom up, from person's life as system through to organisation as system, through to place as system, through to country or region as system. And the overall public management strategy is therefore to create this kind of vertical stack of learning cycles. And I'll talk in particular later on about what the role of the national level scale is in enabling learning at the lower levels. So we call the process of managing and governing these learning cycles and the relationships between them system stewardship. And so it is the job of system stewards to create these learning cycles as healthy systems. So what do we mean by the idea of healthy systems? So we've seen, for example, that healthy systems are learning systems. So these are effective learning cycles at whatever system scale you're talking about. And a healthy system cultivates and makes use of trust. Healthy systems are diverse systems, so they are effective at hearing all the relevant voices of all the different actors in that system. And to do that, they address the systematic inequalities of power that might prevent people's voices being heard and taken seriously. So what we've seen is that system stewards manage and govern these learning cycles so as to ensure that they display these kind of characteristics. So far, theory. Now I wanted to talk a little bit about what this looks like in practice. So this is an example we've seen at that kind of top level of a national scale human learning systems approach. And we certainly saw this by working with the Finnish National Education Agency and their approach to central government that they called humble government, humble government. And the messages from their practice is that the role of national government is to create and enable effective learning systems at a local scale. So what the Finnish National Education Agency does is it plays a learning partner role, not a controlling role. It works with municipalities and schools and families and teachers and enables them to come together as actors at a local scale to ask, what are the child welfare issues at our local scale, and how do we design experiments to respond effectively to those child welfare issues? So the role of national government is to enable local learning. And the nice thing about this is we know that this approach really, really works because Finland's in the kind of top 5 ranked education systems in the world. So that just gives you a sense of what this stuff looks like at scale. And interestingly, what we see about this is, therefore, what is scaled is the capacity for learning itself. I said before we didn't have like written case studies in Australia. What we have is a bunch of emerging examples. So, for example, I was speaking the other day with the people from the Bushfire Resilience Programme created by the Paul Ramsay Foundation and a bunch of other partners. And they are adopting a human learning systems approach to the way that kind of grant giving and learning and public management works in that context. And you're going to hear further examples from Nat and Jane today. So we think that there are some just starting to pop up like examples of what this might look like in an Australian context. So, summary of all of this stuff. A human learning systems approach is a whole different approach to public management. It starts with the reality of how outcomes are made. This is why we call it public service for the real world. And if you want to do this, it means that learning is the management strategy. So if you have any management responsibility, your primary task is to create learning environments. And you can apply this strategy to all system scales, to a person's life as system, organization, place, or country as region. And it is hard work. That's the lesson we've seen from across all the things. My God, it is hard work to create that kind of change. But the payoff is better outcomes for less money. And the kind of both the reason and the cause of that is happier people. So it's happier workforce, much lower turnover rates, much lower sickness rates, but happier citizens too, because they're getting the bespoke response that they want from public service. Now, just final slide for me, kind of talking about this kind of paradigm shift change can feel daunting, but the message from the people that we've seen, like that we've worked alongside, is that you can do it. Because I mean, the case studies we work with are amazing, but they're not superheroes. They're not anything. They're not really special, like far out star people. They can do it. You can do it. If you want to start tomorrow, you could start by asking 3 questions. If you're a public-facing worker, how will you learn with those you support? If you're a leader in any different context, how will you signal that learning is the strategy for all? And what experiments will you create at your system scale to explore this? If you want to see more, there's the whole website with everything that we've found out from doing this for the kind of last 3 or 4 years at humanlearning.systems. And that's it for me now. I hope that was useful for you. Thanks very much.
Thank you, Toby. It's very impressive that you can fit all of those years of work into a 20-minute presentation. So thank you for that. And I can see that the chat is very active as well. There are a lot of questions and reflections and thoughts there. So we're sort of trying to capture that as we go too. If you do want to know more, there is, of course, the more than 300-page report that Toby and his team has put together. But meanwhile, I think, you know, one of the things that stood out, obviously, is, you know, every time an organisation puts these principles into practice in place, it's different. And we really need to learn from doing and learn from a whole lot of different people and organisations. And one of the reasons why we're having this event here today is to talk about how it resonates in an Australian context. So I'm going to introduce to you our first speaker, Nat Smith, to talk about what this means for her and the sorts of work that she's been doing, and particularly lessons from First Nations communities. So Nat is a proud Wiradjuri woman from Condobolin in New South Wales. She is currently the Director for Policy and Evidence at the New South Wales Aboriginal Housing Office, and she brings with her a good more than 2 decades of experience, both in government and non-government policy, predominantly in human services areas. So I will hand over to Nat.
Thanks, Louise, for that. Iridu Marang, good day. I'd also like to acknowledge all of the nations and countries upon which we are all gathering today and pay my respects to elders past, present and emerging, and to my fellow Aboriginal people and non-Aboriginal people on the call here today. Thank you. And I'd also like to acknowledge the cultural and spiritual connection we have to the land, the sea and the waterways. So thanks everyone for joining. So I guess for me, having over 20 years of you know, government and non-government experience has kind of given me lots of different lessons over what to do and what not to do. And, you know, back in the day, as being part of Aboriginal home care, and which was part of the home care service, realising the differences between the 2 different types of service, providing personal care, domestic assistance, and realising how we were doing things differently that really resonated and connected with our people, in the sense of personal cares being an hour, so that we could actually have a conversation and a cuppa with the people that we were caring for, and asking the clients who would they actually like to be their person that cared for them, male, female, Aboriginal, non-Aboriginal, from this land, from another land, and slowly realising that we were starting to do things a lot differently. And that was the reason why we costed a little bit more, was because we were actually putting in that cultural consideration. And I guess, you know, going forward through the various different departments, whether it be an Aboriginal section or a non-Aboriginal section, it was interesting to see the differences between policy being developed with Aboriginal communities, with Aboriginal staff and with Aboriginal managers, as opposed to sometimes that non-Aboriginal vibe. And, people thinking that success looks like, completing education, going to university, 2.5 kids and all of that type of stuff. When sometimes when you actually, ask people, what does success look like for you? And I was recently at a forum, and there was this person there from the First Nations Foundation. It's a financial literacy foundation, and they actually had a conversation. They actually did a survey with a bunch of people, both Aboriginal and non-Aboriginal, on what did richness, what did success look like. And for a lot of non-Aboriginal people, it was a second car, a fancy house, and all of that. And when they actually interviewed and surveyed Aboriginal people, richness to them looked like a fridge full of food. And so you can imagine the different contexts of this rich world that of what success and what does all of this look like for different types of groups. And so going forward, into some of my later jobs, government agencies, if something is evidence-based in like America, we suddenly purchase it for Australia, and we don't look to the strengths of our own communities who actually have the community and the resilience to know what is needed for their community. And, when you spoke to these American companies and to say, well, what evidence base do you have that this works for Aboriginal people? They would say to you, we work with the Blacks and the Hispanics, and it's like they haven't even worked with their own First Nations people. So it's really interesting to kind of, take all of that rich experience as I headed over to the Aboriginal Housing Office to be the Director for Policy and Evidence. And one of the first things that I actually did was actually commission a literature review on getting a bit nervous here. What does success and culturally appropriate co-design, what does successful and culturally appropriate co-design look like for government and Aboriginal communities with some First Nations countries? And it was really interesting to see that there isn't a lot in this space. And so for me, it was really interesting to kind of just see little elements of different bits and pieces. And if we just go to the next slide. So I just wanted to highlight just a couple of things that did come out of the co-design, which gives examples of how co-design has been adapted with an Indigenous context. And remembering that there is not an agreed definition for Indigenous co-design. However, from the literature review, co-design practitioners adapting co-design and related approaches to work with First Nations and communities. A key insight from these examples is that defining Indigenous co-design needs to happen with Aboriginal people and communities. Communities need to be asked what co-design means to them and how it should be conducted. And as you can see on the screen, this is a co-design process that's been developed by PwC's Indigenous Consulting to work with Indigenous communities in a way that merges Indigenous knowledge with modern design approaches. This process emphasises the iterative nature of the co-design approach in this. Their co-design framework identifies the following principles to guide how co-design can be used to recognise and support self-determination: that it's strength-based, frame questions, challenges and assumptions through a positive lens, service design driven by data, walk in their shoes, connection to country and community, storylines, and co-design, creating meaningful outcomes and getting through the process. And when we, over at the AHO, when we do our Aboriginal-led co-design, we do a number of these circles because it takes more than one workshop to actually come up with a model that is best placed for that community. If we go to the next slide. So this is another interesting one that has come from New Zealand. And it's an example of it by the South by the Southern Initiative. And basically this is a Wanu-centric co-design approach, and for a place-based initiative in South Auckland. And as you can see, it presents a co-design approach that was developed by the Auckland Co-Design Lab Standards of Co-Design, and using Maori research principles to inform how co-design could be adapted to culturally responsiveness for Maori and the needs of their communities. And as you can see from the different aspects, from the process to the practical tools, you can see, for instance, that if you look at the top of the green circle, they actually develop co-design principles. And those co-design principles are unique to that actual project. And so that's a really important thing, because self-determination to me, self-determination to you are two different things. And by agreeing for this process what these co-design principles are going to be, helps to keep the culture at the center of how you take it through a co-design process. And so if you can look through there, they've got different ways of the iterations of the circles going forward, but keeping culture at the center by reminding people what this co-design piece is. So this was a really good way for us to start to think about it for the Aboriginal Housing Office. So if we go to the next one. So out of the literature review, it talked about the barriers and enablers of successful co-design in the Aboriginal context. And I think this really resonates with what Toby talks about. What does community need? What does the organisation delivering co-design need? And what does the broader system need? And I think this is a really great snapshot for us, Mob, in Australia, on how do we keep culture centre to the community? How do we keep the culture and the co-design to the organisation? And then how do we actually impact and change systems within government? And if we go to the next one. So basically, from our literature review and from all of this, we actually developed our own, where we were actually going to invest in communities. Instead of taking models from different parts of Australia or different parts of the world, we actually decided we were going to work with communities. They know their social and housing issues. And so through our Aboriginal co-design approach, we decided that we were actually going to take it through an Aboriginal-led co-design approach. When people talk about co-design, everyone's got their version of co-design, and some of it is actual just information sharing, some of it's consultation, and some of it is actual true co-design. And so with us at the AHO, we decided that we were actually going to have an Aboriginal-led co-design approach that focused on keeping culture centre to these communities, but also using our Aboriginal cultural framework, which keeps culture centre, ensures cultural safety, and that has respectful practices around how we work with community. We also have an Aboriginal cultural reference group made up of a whole bunch of amazing different types of Aboriginal staff. And we also have an Aboriginal research and knowledge advisory group. And these are external Aboriginal academics, including an Aboriginal tenant representative and Aboriginal community knowledge experts that come together. So through those types of different things, and also having an Aboriginal staff from both workers all the way to managers, we were able to come up with an Aboriginal-led co-design approach that really supported us to work within an Aboriginal community in a respectful way, where we were actually not the knowledge holders. We worked on contracts that gave Indigenous data sovereignty back to the people. We worked with them and a consultancy on co-design principles. And so you can imagine, for some of these communities, self-determination looks completely different, but how do we come together and have that grounded understanding throughout the whole co-design process of developing this support or service. And, you know, it was really interesting and empowering to see Aboriginal organisations actually leading and actually being able to be that true voice throughout the co-design and keeping us honest. And we also, you know, for some of them, some of their principles was, well, it's important that the voice of elders is heard. And what did decision-making look like for that co-design for that project? And so I guess for us, it was that rich learning and that bravery to actually trust, you know, Aboriginal communities and Aboriginal organisations to actually develop these models with us as a supporting partner, as opposed to a leading partner. And developing up those principles into kind of like an MOU, a very simple MOU, 1 or 2 pages. And it was actually, what was the vision of this project? What were each of our roles? And what were the co-design principles for this project? And at each of the iteration of the co-design workshops, they are discussed at the beginning. And so everyone keeps culture center to that co-design approach. And so I just wanted to show just a couple of things. This is showing you that we are actually putting it into practice. So this is one of our leading community demonstration sites. So we're working with an awesome Aboriginal community controlled organisation called Gunnedah, and they had a vision of creating an Indigenous community hub that people could actually drop in to discuss their housing needs, because they are a housing provider, but also there was a lack of transitional accommodation. And so through a very simplified expression of interest, so we don't ask for a absolutely detailed expression of interest. We talk about, well, what's your ideas and what do you think and who's got the buy-in for that community? And it's from that we then develop that co-design approach to take it through to then develop supports in the service model. And with some funding, they were actually able to buy a pub that is not being used anymore. And so at the moment, they're developing the bottom of the pub to actually be that drop-in Indigenous community hub. And at the top, they're actually developing some transitional accommodation that is absolutely needed for that, for Gunnedah. And if we go to the next one. So this is a smaller version of a leading community demonstration site. It's a client experience initiative. These are kind of like 12 to 18 month initiatives, as opposed to the demo sites, which are a great 3-year process. And working with the residents of a place in Sydney who were wanting to explore how they could better utilise their backyards. And this was just before COVID happened last year. And being able to work with them and you know, some Indigenous agri-businesses, they were able to design a kitchen community hub that really resonated for those tenants living in that home. And as you can imagine, going into COVID and not being able to travel very far, this, and we definitely have some more better photos, I just don't have access to them right now. This enabled them to actually lead that co-design process and to actually design it with recycled Indigenous materials and all of that type of stuff. So I just wanted to show you that there are lots of you know, different co-design processes out there. I just don't think we document them that well. And with what Toby has talked about, I guess you could say we're in that little section of his design thing, and we're in that co-design. So we're in that learning phase, and each time we do a demo site or a client experience initiative, the rich learnings that we get from all of our different sites gets fed back in so that we can make this model much more robust and really succinct to that community. And one of the things that we're now doing is evidencing up our co-design approach so that we can start to make system changes within the Aboriginal Housing Office, and then hopefully, you know, being able to continue evidence up our projects, we're then able to potentially maybe make some government changes as well. So if we go to the next slide. So this was just some feedback from one of our Aboriginal community controlled organisations where we asked them to just, have a reflection question and about being part of an Aboriginal-led co-design project. And so from this person, they said, excellent team from the AHO consultant and ACO, working collaboratively, driven by Aboriginal experts in their fields. Aboriginal-led co-design principles are an excellent piece of work that shows decision-making responsibility with Aboriginal participants and respect from non-Aboriginal partners. They enjoyed the co-design workshops, healthy and respectful discussion, good cultural learnings for non-Aboriginal participants. We were heard and listened to with respect that we know our people and our communities best. And I think that's the thing, is like lots of people have degrees and lots of people have work experience and they're going to go out and save communities. When in actual fact, you will get so much richness and learning yourself, and having that deep listening, that deep understanding, and not being okay to not always have the answers, being okay to allow it to go through that true co-design approach. And you would be amazed at the richness and the strength of communities coming together. And, when we worked with them and we brought in some people who could help develop program logics, one of the key things that all Aboriginal community organisations want to start with is a cultural domain. How are we going to keep our culture centre to this strong and going forward? And it's really amazing to see, staff and end users being part of that process. And some people have actually done it, outside and actually, used the dirt to kind of walk their way through some of the different program logics. And all of a sudden, staff and end users going, oh my goodness, like I'm part of a bigger thing here. And I think that sometimes we forget that staff have such richness and that they're not here for a 3-hour shift. They're here to support a whole bunch of young boys to aspire and to never see the child protection system again. And so I think if there's one key thing that I can say to people is to take off all our masks, to not always have answers, to be in that awkward untruth of not knowing what we don't know, and being able to be there in that awkward space, learning, listening, and together we will come up with an awesome idea or solution or support service going forward. So that's it from me. I'm just a bit nervous, that's all.
Oh, Nat, you're eloquent as always and so articulate. That was a brilliant presentation. And I think, there's been so many comments going on in the chat. I think everybody's got so much out of it. And I think, it's so many different insights there, and there's so much more that we could learn from First Nations approaches. And I think that, the point that self-determination looks different in different communities, and, we really need to sort of learn by doing and really understand the principles and keep culture central. But there will be an opportunity to have a chat with Nat in the panel discussion a little bit later. So I will move straight on to introduce Jane Mccracken, who's the backbone lead at Hands Up Mallee in Victoria. So Hands Up Mallee was established to bring together local leaders and community to address social issues to improve health and wellbeing outcomes. So it works in partnership with the community and local service providers and agencies, and it takes a real sort of place-based approach to make sure that the action taken really reflects that which is needed and wanted. So I'll hand over to you, Jane.
Thanks very much, Louise. Now I'm just going to stumble and put my presentation up. And while I'm doing that, I just want to acknowledge that, Nat, I think so much of the things that you have touched on, that ways of working are really important, and that what happens when you actually sit down and listen to community. I think there's such important points, but what it takes for us to be able to sit down and listen to community, I think is something that we need to answer at an individual level, an organisational level, and a broader kind of systems level as well. So I would just like to start by acknowledging the traditional custodians of the land on which I'm coming to you from today, the Latchi Latchi people, and pay my respects to elders past and present. So my presentation is very much at the level of place. Hands Up Mallee is a place-based collective impact initiative, And in saying that, it's probably important to give you a sense of where we are. So I'm coming to you from, like I said, the lands of the Latchi Latchi people in the northwest of Victoria in Mildura. So I've popped this slide in because I think it's quite important for you to have a sense of where we are, not just geographically, but what that means in terms of a place-based initiative for us. So as you can see on this slide, Mildura is a very, very long way from Melbourne. So we're in the state of Victoria. We're about a 6-hour drive from Melbourne. We're about as far from Melbourne as you can get and still be in the state of Victoria. We're about a 5-hour drive from Adelaide and about a 9-hour drive from Sydney. So we are a community that in Victorian terms is quite geographically isolated, which I think has been probably one of the reasons why we've taken control back of what we think is important to happen in our community. And I think it is probably also one of the reasons why government sort of left us alone a bit and let us get on with it, because we're a really long way. There's a lot of things that you don't see that happen when you're a really long way from the capital city where all of the decisions are being made. So I think our geographical isolation has probably fed in a couple of ways to our community kind of taking a bit more charge perhaps of the direction that we're heading in. So as Louise said, Hands Up Mallee started in 2015, really when a group of senior leaders in our community got together and sat down, looked at another release of census data and thought, my goodness, nothing is changing. In fact, things are actually getting worse. We all are doing busy work. We're all doing good work at an organisational level, but why aren't things changing at a population level? They also decided that nobody was coming to save us and the job of saving us was probably our own job, and that what we needed to do, rather than look for more funding or different funding, was use the funding that we had in a different way. So we decided to take a collective impact approach, which really focuses on listening to community, asking community, making decisions in different ways than perhaps what they're traditionally made in executive offices, but equally valuing community voice, what the research says, and what the population level data says. And I think it speaks a little bit to before what Nat brought up in terms of evidence and the way that we use evidence. I think we rarely question whose evidence it is and how applicable it is to place. And I think that we're kind of quite slow in learning that we can't just take programs from America and plonk them in Australia and think that they're going to work. Or we can't just take things that have worked in metro areas and plonk them in an entirely different system, like a regional and rural area, like where I'm from, and think that they are going to work in the same way when they're in an entirely different system. So one of the first things we did was just to stop and to listen to community. So what community told us was that their vision for a community that they wanted to live in was a connected community where families mattered and children thrived, that they thought that that would take a shared approach of people supporting people and strengthening families, and that we should focus our efforts on prevention and early intervention with children, young people and families aged 0 to 25. And I think the really interesting thing is a lot of that actually aligns with what the research says anyway. And I do think that there is often a hesitation to ask community broadly about what they want because we're worried about what's going to come back. And I think that that is part of the hesitation that we hold on to dictating to communities what needs to happen, because we're scared that they'll say something we can't do, something we don't want to do, or something that's going to require change from us. So our collective is really about listening to community, working with agencies in different ways and working with government in different ways. And like I said, we actually didn't start with any new funding. We repurposed existing funding, probably with what I would call a backdoor handshake agreement with existing funders. And I think, again, that's one of those things that can happen when you're in a small outer regional area. I should probably give you a little bit more context about Mildura. So the Mildura local government area takes up about 10% of the Victorian state. We're right up in the top northwest corner. There's about 53,000 people in the local government area in total, and about 35,000 of those live in Mildura, and the others live in satellite towns around Mildura. We're a geographically enormous local government area. By Victorian standards. We are one of the most disadvantaged local government areas in Mildura. We're the 5th most socioeconomically disadvantaged out of 79 in Victoria. We consistently have appeared in things like the Dropping Off the Edge report that Professor Tony Vincent had produced over a number of years. And like I said, we really realised that what we were doing was really not shifting anything, and we didn't have anything to lose by trying something different. So what's happened so far is we did some work back in 2018, really sitting down and listening to youth, asking what they thought needed to shift in community. And it just sounds so basic, but I think it's so rarely done. And when we sat down and listened, they told us that one of the things we needed to do was really look at what was happening after hours for youth. There were plenty of services that operated between 9 to 5, but that wasn't when they needed them. They needed somewhere to go after hours, on weekends, where it was just a safe place. It didn't feel like a service, where they could come and form meaningful relationships with other kids their own age and have trusted adults that they could speak to and just do everyday stuff. So there were 3 young women who really took that on and developed it into a concept, trialled it with one of the agencies in our region, and 3 years later, it is still operating. It's integrated into the existing service model. It is not drawing on any additional funding. It's a repurposing of existing funding within our community. One of the other things they said was that they felt like there needed to be more after hours activities for kids in our community. And so we did a lot of work developing the partnerships behind bringing agencies that were already funded to do youth work together to deliver an after hours basketball program on a Friday night, where the kids could come, they could have a meal, they could participate in a basketball program and then be driven home safely on a bus, be home by midnight. That sounds really simple, but I think the pushback that we got was incredible from agencies that aren't actually used to listening to youth in community and doing what they ask. We got a lot of, no, my funding doesn't say that I operate after 5. No, we don't do that. We operate with between 12 to 25. You're asking 10-year-olds to come, I can't be involved. And I think when you look at that in relation to some of the things that Toby was alluding to in his presentation, I think it's really interesting when we really start to look at what the purpose of our organisation is and what the purpose of government is. Is it to serve community, or is it to tick boxes for our funders? And I think we've had a lot of really interesting conversations at a community level about what that looks like for us, and a lot of really difficult conversations with agencies. Some of the other things just quickly that have happened is we did quite a large piece of work talking to families of young children about what they felt they needed. Again, they identified that they needed a place where they could go and drop in, where they could be supported by service providers, but it didn't feel like they were going to a service. That has resulted in a place called the Child and Family Hub being set up again by an existing agency integrated into their service model, where we've set it up next to the Kmart car park because community identified that it being in an accessible spot was important. It's a drop-in service that also has maternal and child health there. It has paediatrician there and allied health there. And also has programs running from there. One of the other things that came up in our Mallee Community Voices group, so we have a community advisory group called Mallee Community Voices that's made up from people from various parts of community. They said what they felt like needed to happen to reach that community aspiration was more intergenerational activity needed to take place between children and young people and elders in our community. So we trialled a program called Generations Music Together, which is children aged 0 to 6 and their parents or carers going into aged care and doing a weekly music program. That had extended out to 4 other aged care facilities in our region, but I think one of the probably the biggest win for our region out of that has been having that in aged care. We've had a CEO in an aged care facility who actually was the pilot program for this work, just saw the enormous benefits. This was well before children, young people's home, no, Old People's Home for 4-year-olds was on the ABC. And they've actually gone and built a early learning facility on site at their aged care facility in response to seeing what the interaction between children and the elders in the aged care facility, what impact that had. Now we are in regional Victoria, outer regional Victoria, where something like this would never have been funded had the community not driven it themselves. And I think that's an amazing story of a change to infrastructure and ways services operate that's been driven from a seed in community. I think when we're talking about learning, none of these examples, all of these examples required listening differently to community. None of them had existing funding, and I think it takes a lot of tenacity and real drive from community and belief in a way of working to move things forward without starting with funding. But I think it speaks to what Nat was talking about before, where you need to start and adapt and build, and not necessarily start with the end in mind, but start with co-design in mind. They were driven by community ideas to meet needs that community had identified themselves. They're all examples of where strong relationships were required. And I think, in keeping with what Toby said earlier, none of this work was easy. It all felt like it was pushing at the boundaries. It all felt like it was pushing against a system that didn't really want it to happen. What have we learned? I had a community member say to me the other day that surveys will never spark transformational change. And they wanted to tell governments that they needed to stop and they needed to invest time. Governments and agencies need to invest time in building safe places and relationships with the people that they are trying to help if they want to shift anything. That has come directly from community. And I think all the fabulous lessons that I've learnt doing this work in the last 3 years has come directly from community. My other favourite is that box tickers won't change the world. Again, that is a statement from one of our Mallee Community Voices members. I think I want to put that one on a t-shirt, and I think maybe I should have done that before today, because this would be the audience to be selling the t-shirt to. I think it's really easy to say that you're doing things differently, but I think you need to continually question if you are, and you need to be prepared for savage feedback from the community if you're not. And I think that requires a level of vulnerability in the way that you work when we position ourselves as experts that we're not used to. And I think that that speaks to some of the individual transformation that we all need to embark on to really fully step into this work, not just at an organisational level and at a place-based level or at a government level. Working like this is still the innovation and not the mainstream, unfortunately. And I do think one of the questions you put out, Toby, was where do you think this human learning systems approach is in Australia? I think the fact that this work is still seen in the innovation as an innovation and not the mainstream really speaks to part of where we are with this work. And I think on a spectrum, perhaps we're not as far along as some of those examples that you'd given internationally. I think my feeling very much is that innovations need to prove themselves quickly. We know that the status quo doesn't work, but it never seems to need to prove itself. So in Australia, for example, we spend $48.1 billion annually on social services that we know largely don't work. But we seem very reluctant to try another way of working. Working in the way that I've described doesn't fit with traditional government reporting metrics. And I think that speaks to the metrics that we are reporting to and the way government sees itself and its role. And I think that's problematic for innovations like ours in the system. And it does still feel like we're pushing the edges a bit. And that, I think, is an indication of where we are on the human learning systems journey. I should say that, you know, my example of a community, being in a community who is doing this work, is one of many. And there are a lot of really good examples around Australia of this work taking place. I think Aboriginal communities are way ahead in this work. And I think, as a lot of people have identified in the chat, we have a lot to learn from the way Aboriginal communities are approaching doing work. Another community who is doing great work is in Bourke, the Marinuka work in Bourke. I think there's great work going on in Shepparton with the Shepparton Lighthouse, Burnie in Tasmania, Logan in Queensland. There are numerous examples of this work. I should also say that while Hands Up Mallee started with no funding, we have now moved into a place where we're one of 10 communities in the Stronger Places, Stronger People initiative, which is federally led and backed by state governments, that really is looking at funding this way of working, funding the glue organisations like I'm part of. So I'm not a service provider, I exist in between community and service provision, and really looking at what do we learn from the communities that are doing this work. How do we feed that up, and how do we change policy on that basis? And I think that that is a really exciting change, and it's a really exciting opportunity for communities like ours who are doing this work. Thank you.
Thanks so much, Jane. I love that you said that you can get a lot of things done because you're flying under the radar, so you can get away with things without being noticed. But you really shouldn't be flying under the radar with all the amazing work that you're doing. I'm going to hand over straight to Thea Snow, the Director of the Centre for Public Impact in Australia and New Zealand, who will host a panel discussion. We're sort of pressing up against time, but we have collected an amazing array of questions. So I'll hand over straight to you, Thea.
Thanks, Louise, and it's great to be here. And just a quick acknowledgement by me of the lands from which I come to you today, the Wurundjeri and Bunurong lands of the Kulin Nation. And I pay my respects to elders past, present and emerging. So that's been such a rich conversation, and we actually sort of have pushed further into time than we had hoped, but I'm going to run right up to 6:29 with a panel conversation, and then hand back to Louise to close so that we can get some of these questions that you as the audience have been contributing to our panel members. So I'm actually going to start with a question that I'm going to direct to you, Nat, because it's actually something that we were talking about just before this webinar started, which is around the fact that a lot of people I'm sure relate to these ideas, but the question is from Zara, and she works for a small charity which is underfunded and overworked. And the question is, what is the best way to create a learning environment for colleagues who are overworked and have limited time? And I think that that's a question that I hear a lot when I talk about these ideas with people in all different parts of government as well. So Nat, interested in your experience around that.
Yeah, well, I think for me, it's around having good networks and communities of practice that are out there. And I think, you know, having that curious nature, and when you get to meet different people, whether it's through this or through LinkedIn or through work and all of that, you start to build your own little CV of people who could potentially help you into the future. And so for me, you know, connecting up with Sarah, who worked for Treasury, and connecting up with a whole bunch of interesting and innovative people around the world has actually broadened my horizon and has actually put that the seeds in me to kind of challenge others. So if I was her, I'd start to build my network, that little portfolio that's around me of really smart people.
Brilliant, thank you. And Toby, interested in your reflections on this, in the work that you've been doing with people all over Europe and the UK, how do people find time to prioritise learning when they're being pulled in so many other directions?
I mean, so this is partly it's a question of kind of curiosity, as Nat was talking about, that keeping people's curiosity alive, and that sense that Nat was talking about not knowing, and kind of nurturing and allowing that you don't have to know the answers to this in advance. You can you can find this stuff out. And the kind of the strongest thing I think from the lessons that we've seen from the range of organizations doing it is that what this requires is a change in management practice. So it's moving learning from a nice to have optional extra to, if your job is, if you have any kind of management responsibility, your primary task is to create learning environments for you and the staff that you have. That is the day job. It's not a kind of nice to have addition to the day job. Because if you're not creating a learning environment for your staff as a manager, how are they getting any better at what they do? And it's that shift from learning is nice to have to learning is the job of enabling learning is the job of management. That creates a space, because it means that you can stop doing a bunch of really useless stuff. And it is the things that you stop doing. You can stop with all that performance management nonsense. Just make stuff worse and more expensive. Just stop it, and replace it with learning.
Brilliant, thank you. I'm going to pick up on a question that was just dropped into the chat. Again, this one to you, Toby. So your paper and your presentation, you talk about learning at scale, not producing at scale. Can you tell us a bit more about what that means and looks like? Yeah,
so one of the things that traditional innovation approaches do is they say that they have a kind of learning phase built into the start of a piece of work. So, okay, that we have a problem that everyone recognises. We need to learn and prototype and design and find a solution to that. But once we've found a solution, that is the solution for everywhere and all time. And so the job is to take that to scale. So what we've experienced is people saying, actually, no, let's knock the idea. So the Director General of the Finnish National Education Agency, a person called Olli-Pekka Heinonen, beautiful line, says, scaling is failing, he says. So you should not try and scale what works in one place into another context. It is an approach that's guaranteed to fail and waste a ton of money. But what they found is what you can scale is the capacity for learning itself, because what produced the things that work was that set of learning and experimentation, right? So and this is particularly a role for kind of central government, what central government can do is to enable and ensure that there is that learning infrastructure and capacity and resource in each of the places that where that needs to happen, and that needs to happen everywhere. So but that's what we mean by kind of scaling the capacity for to learn, and that requires a kind of shift in the purpose of central government to switch to this idea of humble government. And that seems like, oh my God, how can we possibly create those kind of shifts in national government? But we've heard from a couple of people today who have exactly that mindset shift. And so all it is a change of practice for people like that, and to say, look, this approach really works. Right? But the idea of scaling learning rather than, and the capacity to learn rather than what it's trying to scale what is learned from each of the places. That's just a little shift that people can make.
And Toby, we don't need any more McDonald's. We actually need to look to the strength of communities and work with the amazing stuff that they actually have in communities and then build around that.
Exactly.
And I think that, yeah, to see our role as differently too, that we are facilitating that coming out of communities, not that we're the ones coming in with answers too, and that our role is to set up those places and ways of working where that can come to the fore. And I don't think it's completely throwing the evidence, that research and data out. It is just a reconceptualizing where that fits in with community voice, and how you bring all of those things together.
And Jane, definitely putting that cultural lens, like what will keep this community rich and strong. And if you start with that, then you can put metrics around it. There are Aboriginal surveys, there are subjective wellbeing out there that could resonate for that community. And it's going that way as opposed to starting with the metrics to begin with.
And I just wanted to pick up on Jane's point there. So one of the organisations that we've seen do this really well in the UK context is an organisation called Research in Practice. And what they talk about is evidence-informed practice, not evidence-based practice or evidence-based policy, because the whole idea of evidence-based policy and practice relies on a view of evidence that is true across all places. And once you take complexity seriously, you know that's just a fundamental epistemological mistake. But evidence-informed practice is about where in the kind of the decision-making chain the evidence is used. So the people in the learning relationships, so the people in communities and the workers who serve them, they are the people who are capable of interpreting and using evidence correctly, because they can be exposed to that evidence and go, what does that mean in this context?
Wonderful. Okay, well, we've got time for one more question, and I'm going to ask this one. I'm going to choose this one because it's a bit different to some of the others. And it comes from someone in the audience who doesn't work in a sort of social policy area. And he's asked the question of, could we apply an HLS approach to portfolio areas? These are sort of my interpretation of his question. Could we apply an HLS approach to portfolio areas beyond social services? So what might HLS look like in foreign policy, for example? So Toby, I'm interested in your sort of thoughts around that theoretically, but Jane and Nat, also keen for you to think like on the ground, you know, could this extend beyond the sort of traditional social services that we've been talking and focusing on today?
Wow, that's a tough question. That's a great one. So one of the things I would say straight off the bat is that we don't know the scope for HLS approach to public management. Like we don't know what those boundaries are, because we keep finding new examples of people trying it in different contexts, and the only way that we'll know whether it works or applies is when people try it. What I would say is we've seen it work in a kind of variety of contexts that one might say outside the kind of human services thing. So one of the case studies on the HLS website is a planning department in a UK council, and that it turns out that the act of working with planning applications that one would thought is a kind of fairly mechanized process-based thing is actually highly relational, and the more relational that you make that practice, the better and more efficient that it gets. In relation to the question about foreign policy, also the other relevant case study that we've seen is one from the UK government's Foreign and Commonwealth Development Office. So in their kind of old practice as the Department for International Development, there is a range of practice that they developed called adaptive management, because basically from an international development perspective, you've got a bunch of complex, what they often call wicked problems that people in kind of the government in the UK, they can't solve like problems of poor governance in Kyrgyzstan, and they don't know what the best practice on the ground for developing agriculture is in Sierra Leone. There's no way that they can know that stuff, so that they have to give resources for programs in a way that enables people on the ground to identify and solve their own problems. So there's actually a bunch of really interesting practice developed in the international development space that looks and feels a lot like human learning system stuff.
Brilliant. Well, I would love to hear from Nat and Jane, but unfortunately we're at time. So I probably shouldn't have asked that last question. I just couldn't help myself. So I'm going to respect everyone's time and hand back to Louise to close.
Thank you, Thea, and everyone. There's been so many rich reflections and insights, not just from the speakers, but from everybody here today. I would just like to say in wrapping up that there have been some questions about how you can stay a part of this community. Human Learning Systems is a global initiative, and David has been putting the link into the chat as well, and we can send that around to people afterwards who are interested, so you can stay connected and be part of that global community. If you're interested more specifically in a sort of relational or caring approach to working in the Australian context, CPI and Thea Snow is doing a lot of work in this area. Sydney Policy Lab is as well, so we're happy to speak to you as well. You can get our contact details from the website, reach out to either Thea or myself or our colleagues. I think the message from today is that this work is so important, but it's not always easy. So we're really keen to find ways to create a community of support. I'd finally just like to thank David Murukumthara and also Janani Janathana for their work in putting together the webinar. They're both from the Sydney Policy Lab and CPI, and they've been outstanding in pulling all of this together. So thank you so much. Thanks to CPI for the opportunity to co-host. And finally, to all of you who have made the effort to come along today and spend the time with us. So please do stay in touch, and thank you again for joining. Okay.